Hello everyone, welcome back to my channel Homeopathy Remedy Marvels. And dengue cases are on rise. Every day we are seeing cases of dengue in clinical practice, and as clinicians we must be fully aware of dengue and be informed about its details in order to be able to manage it. As we know, this is a serious viral illness that spreads rapidly. So in this video I am going to walk you through the various aspects of dengue. Now dengue is given many names. Among them the common one are, it is also called as break bone fever because of the nature of pain that it gives. It is also called as dandy fever. Now just to give the definition of dengue, it is a acute viral infection with diphasic episode of fever. Along with that, the patient also presents with severe form of headache, myalgia and rash, which are caused by a dengue virus. Now which virus is that? It is the toga virus, or also called as flavivirus. So clinically the patients can come with various presentations. Some patients can actually have no symptoms at all, so they can be asymptomatic. Some patients can come with the classical symptoms of dengue. Some patient can have dengue hemorrhagic fever, so they can be in this stage, or they can come to you with dengue shock syndrome. So the patient is actually in the stage of shock. Now, as we know that this virus is harbored by a female Aedes aegypti mosquito, and it's actually of 4 types. So dengue 1 virus, dengue 2 virus, dengue 3 virus and dengue 4 virus. Now of course the onset is acute, but the incubation can range up to 3 to 15 days. Let's talk of the symptom presentation. As I told you, the patient can have variety of symptom complex. Now generally the patients have high grade fever with chills, rigors, and patient will be relaxed by sweating, or during this sweat stage the patient will feel comfortable. The patient can also have severe frontal headache, and they can have pain in the globe of the eyes, and patient can also have backache, and patient can have pain in the long bones. So in the limbs they can come with pains. Again, patient can also have associated symptoms like nausea, constipation, altered taste or smell. Patient will be lethargic or will have prostration, may even feel depressed. Now when we examine such case, there are certain things that will be observed. Usually on the 3rd day of the onset of the disease, the temperature will be very high. So this kind of a curve is seen. On the 6th day, the patient can come with a rash. You can see that the lymph nodes, especially the cervical group of lymph nodes, will be enlarged. Patient can have bradycardia, they can have hypotension, they can present with insomnia, difficulty to sleep because of pain and fever. Sometimes the spleen can also be palpable, but it may or may not be. Patient can come with redness of the eye. In case the patient has come to the stage of dengue hemorrhagic fever, of course, you can see the hemorrhage on the skin, or it can have nasal hemorrhage as epistaxis, or patient can even have GI bleed. In case the patient has now come to the dengue shock syndrome, then patient will have classical features of shock like pallor, anemia, BP will be very low, patient will come to you with cold extremities, the pulse will be weak, and they will be restless. So we have to be fully aware that this stage is a stage where patient might need to be admitted in the emergency department. Now let's understand what are the complications. This is very important. As clinicians, we must be fully aware. Now the complications of dengue, of course, to begin with, it's the hemorrhage, because patient needs to be stabilized if the bleeding is more. Patient can have ear infection or otitis media, middle ear infection. Patient can land into bronchopneumonia. I have made a video on pneumonia. If you wish to understand pneumonia in detail, you can go and check the video on my channel. Patient can have additional infection like herpes. Patient can have orchitis or uveitis as a complication of dengue. Of course, in case of shock, they can collapse. In long-term effects, we have seen patients have a lot of hair fall, bone marrow aplasia, and encephalitis. In some rare cases, this can be a complication. Now coming to the investigations, it's very important to regularly advise the patient for the cell counts. The first initial investigation generally advised is on suspecting the case is dengue NS1 antigen and IgM and IgG. You can advise the patient this thing. These investigations together can also help us to understand the duration of the infection. Now, when we go for the complete count, we will notice leukopenia, we will notice toxic granulation of polymorph, we will notice, of course, thrombocytopenia. Patient can also have albumin present in the urine. They can have a positive complement fixation test and ELISA positive. Now, of course, in dengue, prevention is better than cure. We all are aware of what are the preventive steps that must be taken when the dengue cases start to appear. And there are prophylaxis often advised as genus epidemicus in homeopathy according to what is the symptom similarity. But just to give the list of remedies that must be advised along with very important routine of the patient, which includes hydration and rest. So the first remedy to think of is Eupatorium perforatum, where the patient have pains as if the bones are broken. They have morning chills, thirst is increased before the chill stage. Of course, occipital pain will be present and the patient will have relaxed stage during this sweating. Another remedy can be thought of as Brainia, where the patient shows some kind of an anger and agitation and does not want to be disturbed at all, along with the dryness. And worse, even on the slightest motion, the patient will be completely asking to be still, undisturbed. Thirst will be increased. Think of Gelsemium, where the patient have dizziness and dullness, trembling. Patient will have chills, will be shaking, and will also have desire to stretch. You can also think of aconite in the early stages, where the presentation is violent, patient is very restless, has heat in the body, very thirsty, and the pulse is full and agonizing, and the skin is hot to touch. So think of aconite. You can think of belladonna. Again, if the patient is coming with redness of any kind, throbbing pulse, and if a patient does not say that I am relieved by sweat, then you can think of belladonna. You can also additionally start with ferrum phos. Again, in the first stage of inflammation, we think of ferrum phos, where the patient is pale and or flushed. And then you can think of ipecac. Again, the prescription will be decided on the basis of the totality of the case, the individual presentation of the case. And I hope that with these details, you will be able to manage the case of dengue. Thank you so much for watching my video, and please do subscribe, because I will be trying my best to come up with more such topics, and along with them I'm going to give you list of homeopathic therapeutics. Thank you so much.